All right. Hey, everybody. Welcome to day 2 of Big Barker's second annual Arthritis Awareness Week. My name is Eric Shannon, the founder of Big Barker Dog Beds, and we're here with two very special guests, Dr. Hannah Capon and Dr. Kathy Murphy. Dr. Capon is the founder of CAM, which is Canine Arthritis Management, and she devotes her life to educating about canine arthritis, and we're very lucky to have her here as the moderator for this week. Dr. Murphy is a qualified veterinary surgeon with a PhD in behavioral neuroscience. She's currently the director of the Comparative Biology Center at Newcastle University in the UK, and she's also created a science outreach project called Barking Brains, which you can find on Facebook. We're going to put a link to it down in the comments below. Now, the reason we're here this week is because arthritis is a terribly widespread health problem faced by dogs. It's estimated that 80% of dogs will suffer from it as they age. Now, at Big Barker, we make a special bed that's designed to help reduce pain and enhance mobility to fight against arthritis. So we put this week together to give our customers and all dog owners some tools and tips to fight back and to extend the happy and healthy years of our dogs' lives as much as possible. Now, today's topic is the power of the canine brain on masking pain. So Dr. Capon and Dr. Murphy are going to teach you some very interesting and some very practical things about how your dog's brain works and how you can adapt some things in your own house and with your own dog's routines that can really help them stay as healthy and happy as possible for as long as they can. So please leave comments and questions while we're here. We'll do our best to answer as many as we can at the end. And don't forget to sign up for Arthritis Awareness Week because we're giving away $400 of awesome prizes every single day. We'll put the link in the comments below to do that. So, all right, guys, I'm going to hop off and leave it to you.
Thanks, Eric.
Thank you. Really glad to be back here again, and very happy to have my lovely friend Kathy, because what we really want to do today is give you tools that you can use immediately in your management plan. And also, a question that was brought up a lot yesterday was, how can we prevent it? How can we slow the progression, etc.? And I feel that this topic is going to really light some light bulbs in your head. So first of all, we're going to talk about the pain pathway, because many people believe that pain is in the location where you feel it, but it is not. So please, Kathy, can you explain this?
Yeah, so let's say, for instance, we tread on a piece of Lego. That's probably something that's quite painful, isn't it? We tread on a piece of Lego, then the pain receptors in our skin are what detect the nociception. So they're nociceptive receptors, which are pain receptors, although pain is nociception plus emotional component, which is what we're going to come on to talk about. So if we just think of them as nociceptive receptors, that means they're actually detecting whether there's potential trauma. That's basically what they're detecting. So they will then fire and send a signal, and the signal will travel up very long neurons all the way to the dorsal horn of the spinal cord, where it will swap over onto new neurons that then run all the way up to the brain. And then within the brain, it will be processed by areas that are within the center of the brain. So those areas that are associated with more kind of sensory integration, so deciding how much of the signal to let through, how much of competing signals to let through, so kind of working out what the tapestry of the signals will be at that particular time, and then integrating that information with all of the other information that the brain has. Because of course, when you tread on a piece of Lego, it's not only important that you feel that piece of Lego under your foot, but it's also important that you look around you to see whether lifting your leg quickly is going to cause you to fall down the stairs, or whether you're walking straight into a path with loads of Lego, in which case you want to go backwards, or whether actually it's one piece of Lego, in which case you can just go forwards with the other foot. So there are all of these things that happen very, very quickly that you're usually not aware of, not conscious of, because by the time you're kind of consciously aware that it was Lego, you're usually holding your foot by that stage. But of course, your brain has to integrate all of that information whilst it's receiving that nociceptive signal, so that it can essentially help you decide what actions you need to take immediately and then what actions you need to take more long term.
It's fair to say that pain is an end product in the brain, but there's a hell of a lot that goes into creating that perceived pain experience.
Yes. So actually, scientifically, pain involves perception. So it's impossible for you to be in pain if you're not perceiving. So a good example of this, I'm an anaesthetist, would be when you're under general anesthesia and you have surgery. There's no doubt whatsoever that cutting into you with a scalpel is stimulating all of your nociceptors. Like, that is trauma at its very best. But you're not able to be in pain because your brain is anesthetized. So it's not able to perceive those signals and not able to process those signals in the same way. So that's why scientifically we talk about pain involving two different components. The nociceptive component, which in the case of surgery is still going on, and it's still really important that we give painkillers whilst the brain is not perceiving that pain, because part of the signaling of that scalpel blade is all of the pain mediators and all of the neurotransmitters and cytokines and all of the other things that are released into the bloodstream in response to that scalpel blade that your brain isn't perceiving at the time. But if you don't have painkillers whilst you're having surgery, you're going to wake up in an awful lot of pain because all of those mediators will be released into the bloodstream and just sitting there waiting to cause a lot of pain when you're conscious again. So the definition of pain is that it involves this nociception, but also the perception. So that's the emotional component and the cognitive component. So the ability for you to recognize that you're in pain.
And then, because we now know that perception of pain is in the brain, we also have our emotional component is influencing our perception in our brain. So that piece of Lego, if I had a bad day, my car had broken down, I'd got caught in the rain, all of those horrible things, and then I stood on the piece of Lego, it's going to feel worse to me than if I'd just won the lottery, I'd just been bought a new car, and the sun was shining. It probably wouldn't feel so bad.
Yeah.
So there's a huge emotional impact on how we interpret those messages. So the reason that we're telling you about this is because it's part of our toolkit in managing pain, chronic pain, which arthritis is a key leader in creating. So everybody always thinks as soon as you say the word pain, it must be drug related. This is how we're going to intervene. We must use a pharmaceutical or a supplement or a therapy, and we overlook what we have available to us at that very time. So talk to us a bit about these neurochemicals, because I'm definitely pushing you in the direction where we're going to start talking about activities, and therefore activities that are good and activities that are bad. So tell them about neurochemicals and what they're capable of doing.
Yeah, so neurochemicals are really interesting because they're acting at all of those different parts of the pain pathway. So when initially you have the nociception, so that's the piece of Lego or the scalpel blade, you've got a whole bunch of local neurochemicals that are being released, but also being trafficked to the site. So they're being released and then moved to the site. You've obviously got inflammation around the site as well that's starting to form. But those neurochemicals can be the type of neurochemical and the degree to which they're released, and interestingly enough, how they attach to the receptors at the site of the trauma, so the Lego or the scalpel blade, are hugely influenced by your emotional state at the time. So we know that they're influenced by epigenetics. So some people have what we call a lower pain threshold than others. But what we've discovered more recently is that actually the immediate neurochemical response to that trauma is different depending on what emotional state you're in. So more anxious people, for instance, most of these data come from people, but it is backed up with some animal studies, particularly in rodents. But anxious people, for instance, are usually have what we call a lower pain threshold. So they're more likely to experience pain more intensely in that example. And that's partly because the neurochemicals that are being released either in a greater volume or a different ratio at the site than they would have been if the emotional state had been different. So it's not just the case, we like to think of psychosomatic as being all kind of fluffy and cloudy and, oh, well, it's all in your head kind of thing. Well, it's not only in your head, it's in every part of the pain pathway, because it's actually affecting the way the neurochemicals interact with your neurons and help to kind of process that pain signal. Now, neurochemicals are also important in the same way when we get to the spinal cord for that crossover between those neurons that have brought the signal to the spinal cord and then the neurons that need to take the signal up the spinal cord towards the brain. And then, of course, when we get to the brain, we've got a whole complex environment where neurochemicals are being released in different ratios in different brain areas, depending on a number of things. So your emotional state, your cognitive state, so not just your emotional state, but if you're particularly anxious, but you're anxious about something that has nothing to do with Lego, and it's a really intense anxiety that is already cognitively located on some specific circumstance, then you won't necessarily feel the Lego either, because your brain is busy taken up with anxiety about something completely different. If you just got generalized background anxiety, then your brain will go, woohoo, we've got an answer to why we're anxious. It's the Lego. And so it will pour everything, all of your attention, all of your cognitive focusing onto that piece of Lego, and then you can start to catastrophize. It's particularly bad if you told your kids for the 100th time to tidy up their Lego. That's probably when you're going to feel the piece of Lego the worst.
The Lego the worst, exactly. So we're already kind of letting people realize that it's not a light switch. It's not a certain amount of trauma creates a certain amount of pain. There are so many areas that it can be affected, and it can be ramped up and it can be ramped down. And we can either ignore that and abuse it badly, or we can accept it and make use of it. And this is where we're going to now move into, why are we talking about this? Because let's talk about abusing it. Let's talk about activities that are likely to make pain worse or delay a quite explosive pain, because you know where I'm leading with that one. But things like in the moment, emotional state of the dog, if they're not in a good place, if they're bored, if they're frustrated, if they're anxious, they are likely to perceive pain worse than dogs that are enriched. They're moderately active, they're engaged, they're in a positive environment where they feel safe and comfortable. So what do you agree with that? So putting a lot of energy into a dog's daily life, as well as the pharmaceuticals, as well as the supplements, is really important in managing their pain state.
Yeah, and that could be direct or indirect. So there's actually really good data in the human world about this, because what we've done in the last 5 to 10 years is shifted away from pharmacological treatment of chronic pain in humans. Now, I'm not saying everyone has, because there's still a huge reliance on it, but it is quite old-fashioned. And if you look at the London Pain Consortium or the Bristol Pain Group, for instance, all of the big research centres for human chronic pain now have moved away from pharmacological intervention, and they'll use drugs as background to, if you like, kind of smooth out the peaks and troughs of the pain. But what they found is much more effective in terms of giving back people the quality of life and the enjoyment in life is actually focusing on things like exercise, hobbies, enrichment, CBT, so kind of the power of positive thinking. And CBT is not quite the power of positive thinking, but those kind of interventions. And they found that they have much bigger effect sizes with those interventions than they ever had with pharmacology, than they ever had with any drugs. So it's really, really powerful. And in those patients that take it on, they see huge improvements in patients that have had chronic pain for decades, some of them, and have been really heavily drug reliant previously. So it's really something that we should be learning from the data that are out there. And if we look, you might say, well, that's humans, is that really dogs? Well, if we look at what we're discovering in animal research, we are seeing parallels with that. So we're seeing that pain can be modulated by anxiety. So strains of mice that have high levels of anxiety, genetically they're bred with high levels of anxiety, have higher pain scores when they undergo aversive treatment, whether that's surgery or whatever. Come
back. Oh, where are you?
Am I not there? Have you lost me? Oh no.
I think Hannah's frozen.
Oh, it's Hannah, is it? Not me.
Yeah, you're so good.
Shall I carry on talking to you, Eric?
Yeah. She'll pop back in.
She'll come back in. So I think it's important for us to start thinking about this for our canine companions, because it's true that for acute pain, we often, pharmacological intervention is absolutely the right thing to do, because part of what we're wanting to do when we're treating acute pain is prevent chronic pain from developing. That's actually the main goal for treating acute pain. It may not be the main goal of the patient, but for the treating clinician, it's the main goal to prevent that patient from developing chronic pain. But when we get to chronic pain, really the main goal is quality of life and how good the patient feels about their life. So that's where we need to be thinking about enrichment and exercise, how we use those constructively so that we're improving the quality of life. And that will look different for a patient in chronic pain than it will for a patient who's not in chronic pain, because obviously they have different needs.
So when you say using exercise constructively, what would the difference be between using it constructively and not constructively?
So it's true, if we go back to kind of the influence that the brain can have over the perception of pain. So one of the important things is that if the brain is super excited, so if it's running around, like physically, as in the body is running around, doing exercise, like running a marathon or chasing a ball in the case of a dog, the brain will release a lot of neurochemicals that actually dampen down the pain signals. Why? Because there's no biological advantage to perceiving pain when you're being active. Like, there just isn't any biological advantage. If you're going, oh, Eric's disappeared now. You're back in the seat.
I don't know what happened there.
So we're talking about examples where you could abuse exercise. So yeah, if your body is active, very active, like ball chasing or like running a marathon in the case of a human, there is no biological advantage to perceiving that pain. It doesn't mean the pain's not there. The pain is still there. All of those cytokines are being released. All of that inflammation is still there. All of that kind of potential damage to joints, etc., is still continuing. But the brain just, if you like, switches off from perceiving it because there is no advantage. I might as well just get on with the exercise I'm doing right now. So the animal, if it's chasing a ball or if it's, I don't know, on a bike ride chasing you along with the bike or whatever, won't perceive the pain at that time. But if they've got arthritis, they for sure are in pain. They have nociception, it's just not being perceived, and they have all of the other pathologies that are going along with that, or acute changes. And the difficulty with that is that once the exercise is finished, those neurochemicals will reduce again. And so you've got two things that concern us in that example. One is that you get a delayed pain effect, and that's the classic, oh, he was fine on the day, but he's a bit stiff for a day or two afterwards. And actually, you know, I know how easy it is to do this because I took Nancy to the beach. She hasn't been to the beach for ages, my Rottweiler, and she's got spondylosis. And we ran around the beach. I kind of cut it short because I knew we hadn't been for a while, and she seemed absolutely fine on the beach. She seemed absolutely fine when she got out of the car, absolutely fine until that evening. And then I noticed her get out of bed like an old woman, like, And that's when I thought, shit, okay, I've just done exactly what I tell everyone else not to do.
We all do that.
That's how easy it is to do. And she had a great time. It wasn't like she didn't enjoy it, but she sure as hell paid for it for 2 days afterwards. So now
we do it because we're looking after our own mental state, and it makes us happy to see them happy.
Yeah.
And therefore you kind of go, oh, go on, just have some fun. And then both of you suffer later because you're suffering looking at them suffering. You feel guilt, you feel like you're the bad owner, you should have known better.
Yeah.
And so
like Hannah's going to come and tell me off.
I am. But no, that's really true. So the thing with the ball throwing, just to kind of go back to that, and because it's such a thing that everybody does. Balls are for sale everywhere, ball chuckers, frisbees, all of these high arousal activities. What role do you feel they have in confusing people with regards to their dog's pain picture?
In terms of if you're playing a lot of ball with your dog, is it going to confuse what's going on? I think a lot, right? Because if you speak to people that throw the ball for their dogs, most of them they're not 100% convinced that their dog is in pain. Or if their dog is in pain at other times, they're not 100% convinced that it's related to the ball throwing. Though, usually those are quite common conversations that I have, is speaking to people. And I'm surprised because we have this conversation quite frequently, and to me it seems very logical, but then it would, because it's what I study. So I think about it a lot.
I think the classic phrase always is, he wouldn't do if it hurts. So he wouldn't shoot the ball if it hurts. He wouldn't jump on the sofa if it hurts. He wouldn't jump out the back of the car if it hurts. And I think that's really hard to step over, because we give our dogs everything. We give them choice. So you would imagine them to choose not to do something if it wasn't to their pleasing. But actually it's so far from the truth, because they're in a different place in their head. They've got other things that are more important taking over.
Yeah.
And I think for me, my wish with CAM has always been to give everybody options. You might have all the money in the world and be insured up to the hilt, and you can pursue any intervention that you would like. But you might also not have that capability. You might be struggling a little bit financially, time-wise, physically. There are still many things that you can do. And for me, it's something everybody can do. Everybody has access to this. And as you said, what's really exciting about it is it's beginning to reveal itself as more powerful than the interventions that are quite costly.
Yeah, and I don't know that we've exactly made the point that actually exercise is really important for well-being. So going back to what I was talking about with the human clinical data, what we know is that sedentary people get depressed and anxious, and their pain scores are much, much higher. So people who actually get out and do exercise, even if it is a little bit uncomfortable when they're doing it, actually have lower pain scores. And that's partly the mental health benefit of doing the exercise, and it's partly the neurochemicals that are helping to dampen down the pain signals, so that the nociception is still there, but they're dampening it down, but on a not just in an acute way like with the ball throwing, so that you get much more pathology, but you're dampening it down, but actually just in a background way, so that it's just taking the edge off the pain, allowing the joints to move, allowing the muscles to keep some tone. Because remember, if we're sedentary, then our muscles atrophy. And then it's much harder to lug our skeletons around. So it's really
more about the type of exercise, isn't it? What you're trying to get to is no exercise is bad.
Yeah.
Completely crazy exercise is bad.
Yeah.
And it's like my mum used to always say to me, and it really irritates me, everything in moderation, Hannah.
Yeah, it's true though, right?
Drinking, that applies to going out, everything in moderation, Hannah. But this is an absolute classic example where we want you to be out exercising. We want you to be taking your dog out and keeping them moving. But we want you to think about what you're doing with your dog.
And how do you know? You avoid twists, turns, sudden changes in direction, sudden acceleration, sudden deceleration. All of those are going to make the arthritis worse. And you also look to see what the effect is the next day, the day after that. Yes. And that's what I'll be doing with Nancy. I won't be doing anything cleverly scientific. I'll just be moderating her beach exercise. So we do a lot more scent work on the beach. We do have a long line. She'll still go off lead for a small bit of it, but maybe only a few minutes at a time. And then what I'll do is see what the effect is the following day. And it might be exactly the same, in which case I know, okay, we have to cut it down a lot, or we have to avoid the beach. But actually, the beach is her happy place. So for me, it's so important for her quality of life that she has beach time, that we just need to work out how to do that in a safe way so that she doesn't pay for it later. And that might be on a long line. It might be doing more searches for food. It might be doing more interaction with me so that she's not bombing around like a loony, or it just might mean not taking the puppy with me, who probably winds her up and makes her run faster.
Yeah. And then think about that whole concept. We've potentially avoided some vet visits. We've avoided being put on another pharmaceutical on top of another pharmaceutical on top of another pharmaceutical.
So what would I do if someone brought Nancy into me as a vet? I would probably give them more painkillers. Whereas actually what I should be doing is having a consultation with them about the exercise and a plan for how to moderate it, because that would actually be a lot better longer term. But in a 10-minute consult, when people expect results, usually what they're going to be presented with is more pain relief.
Yeah.
So I do think it's good for the owners to be able to understand this, because they are the ones that are the carers for their pets. They are the ones that are going to see this. They're the ones that are going to be able to make changes and then look for the differences, so that they can tailor it for how the pet is doing at that particular time and how the disease is progressing, etc. So it'll look very different for different dogs. And for Nancy, it looks different in the summer as it does in the winter. And, looks different depending on whether she's been out the week before, or, there are other variables that feed into it. And it's a wake-up call when that happens, to just say, okay, I got it wrong. Let's have a think about, what's going to work better.
Yeah, definitely. And I know giving people really good, easy take-homes is that when Holly, my dog, was suffering, I'd have in my head indicators. So if she was roached in her back, so her back was kind of like angled, if her ears were back, if she just walked like this, if she whisked with her back legs instead of striding, and she whisked, and if her tail was down, I was like, you're having a bad day. So let's just do a gentle walk. Let's get the licky mats out. Let's get the snuffle mat out. Let's keep you warm. I'm going to keep you moving. I'm not going to ask much of you. But when her ears were forward, her back was flat, her tail was up, she was striding out, I was like, she's having a good day. Okay, we can push it a little bit, but I'm not going to push too much because I don't want to go over that cliff.
Yeah.
So looking at what your dog is telling you and modifying your activity in the home, out on your walks, can be as powerful as pain medication. And that's what I really want to get across today.
I think really important. And another example for Nancy is that now she's got spondylosis. She's a really good scent detection dog, but now she's got spondylosis. She just lost her enjoyment of scent detection. So I went back to her searching for food. She loves it. She has a great time. So I'm not going to push her to detect whatever odor it is I wanted to put her on. I'm just going to leave her just searching for food, because she has a great time. And it's good for her quality of life, it's good for her mental health, and it's something that she finds super easy.
And it's good for you because you're happier watching it.
Yeah, exactly. Yeah.
So I popped on because we have a bunch of questions here that I'm going to share.
So I disappeared. It just didn't like me for a moment.
Yeah, I thought you just didn't like me.
So here's from Chris. Is sprinting considered crazy exercise? One of my Danes loves to run fast in short bursts.
I mean, for me, it depends on, is that a young, healthy dog? Is it a fit dog? Is it an unfit dog? Is it a dog with arthritis? If it's a dog with arthritis, then sprinting could be problematic because it usually involves very high acceleration and deceleration, potentially, but certainly acceleration. If it's a young, fit, healthy dog, then there's nothing wrong with spontaneous sprinting. I personally am not a fan of non-spontaneous movement. I think if you've got a very fit dog and you stick to a good fitness regime that includes massage and physio, etc., I don't see anything wrong with some of the dog sports where you do have forced exercise. But I do think generally that we underestimate just quite how much body conditioning is required for a pet to be healthy and do those kind of dog sports. So I prefer spontaneous activity. But in a young, fit, healthy dog, there's nothing wrong with spontaneous activity like that. With a Dane, I would worry about twisting and turning. So I worry about that with all big dogs, just because their center of gravity is so high. So it actually doesn't take much of an angle change to cause quite a bit of torque on the limbs, and that could be problematic. I don't know if you agree with that, Hannah.
I totally do. And I'm just saying simple, they're big and gangly.
Yeah. Yeah. They also only have 4 motor neurons, right? 1 for each leg. They're not quite connected in the brain always. They seem to connect at about 4 years old, and then they disconnect at 6 years old again. They're only coordinated for a couple of years.
So I have this is a 2-part one from Crystal here. It starts off with, my dog with arthritis seems to hurt much more the day after a walk. This makes me scared to take him since I don't want to hurt him more. And then she says, where'd it go? How would I moderate a 15-minute walk if that makes my boy hurt the next day?
Yeah.
First of all, can I just butt in? I think you need to speak to your vet, because if a dog is crying or making any kind of vocalization, I don't know if your baseline pain control is good enough at the moment. So every dog, we should aspire to having a good pain relief in the background that they can do 10 to 15 minutes exercise pretty comfortably. Even if that's a slow paced walk, that's quality of life. So if you're not managing to achieve that, I'd go back to your vet and just say, right, come on, what's in the toolbox? What are we going to do with this one? Because this isn't controlled. I know it's not.
And until you get the pain under control, I would just look at enrichment activities rather than exercise. So things like, if you go on the ACE Connections page, Sarah Fisher's free work is really good for that sort of thing. And also Canine Enrichment, Shay Kelly's page is also good for ideas. But I would look at non-ambulatory stimulation, and then, like Hannah said, get the pain under control.
So how about from Norma? My 9-year-old has trouble getting up from laying. It takes her a few minutes to move when she stands. After a few minutes, she can move normally. What's your suggestion?
I would definitely have a help 'em up harness, or one of the derivatives of that, because think about it, okay? If your grandma was struggling to get out of bed or struggling to get out of her seat, we'd give them a walking frame. We'd give them a chair that lifts them forward. We'd give them a bar to assist them down the stairs. We even have this photo of this dude in bed, and he's got this like step ladder attached to the base of his bed so he can pull himself up. We have so many assistive devices to help us not overdo it, not do more harm, make it a comfortable process, not be scared of it because it's going to hurt. So I would be getting in there with a help 'em up harness. I'd make sure that the bed was a good quality bed. Nice matting all round said bed, so there's no risks of any slips. And I would support them and help them. I would not sit back and go, you'll get there eventually. It's not going to help those tissues at all.
Yeah, the mats around the bed as well is a really good tip, because it is really difficult to get up if your front legs are on slippery, not even slippery floor, but just floor where you have to grip, and your back legs are still on the bed.
I'll second the help 'em up harness recommendation. I use that with Hank for probably the last year to year and a half, just because there's so many different handles depending on like how much support they need. You got the one in the back, you got the shoulder strap, you got the one in the front. Really helped him quite a bit, because he had the most trouble just getting up in the first place. But once he made a couple steps, he was much better. So yeah, fantastic type of harness.
Yeah, and I think people need to kind of stop seeing these pieces of equipment as the end of the road. They're not. They're just part of rehab. And you wouldn't say to your grandma, oh, you got a Zimmer frame, you're going to be gone next week.
Yeah.
It hasn't happened for 10, 15 years. It enables. It's not there because they're disabled. It enables.
Yeah.
Another Great Dane question. So Pandora asks,
Great Danes.
I've been told to limit their exercise until the growth plates are closed. How much daily time do you recommend?
Oh, I'll let Hannah take this one.
Okay, so
5 minutes per month. That's all I'll say.
Yeah, so that's a bit like the 5 fruit and veg a day, which comes from nowhere. It's just this guidance trying to encourage people to eat more healthily, but there's no scientific data to back that recommendation. And the same exists with this 5-minute rule per month of their life. So what they've actually done is looked at dogs that have much greater amounts of exercise at these vulnerable periods in their life. And it isn't risk inducing, it's the type of exercise. So you can have lots of dogs that can do quite a lot of exercise, which is consistent, low impact, and it's actually really good for them. It builds strength, it builds what we call neuromuscular stability, proprioceptive ability. It's great for their socialization. But when it actually comes to being bad for their growth plates, no, it's absolutely fine. What they have found, though, is when you're doing high impact, high torsion, acceleration, deceleration, running up and down stairs, that's when it starts getting worrying. So it's definitely a case of slowly increasing your dog's exercise as long as it's sensible and watching what the end result is. But there's nothing to support the 5-minute rule. What you need to do is do what your dog is comfortable. So when Luna was a pup, we still went on quite long walks. We built them up slowly, but I just didn't throw balls. I didn't throw sticks. I didn't let her go crazy. I let her meander.
And give them an opportunity to rest. So quite often with an adult dog, you'll just keep walking at the same pace. But with the younger dogs, it's a good idea to stop occasionally and just hang around and see what they do. If they're still going crazy and they want to carry on, then great. But some of them just want to kind of sit and watch the world go by for a while. And that's probably them just taking a bit of time out and, resting for a little bit.
Yeah.
So Laurie asks, so she has a shepherd who loves to fetch his ball. How do you know when it's too much?
Good question. Again, it's the same message. It's not that ball fetching, per se is the devil. It's more looking at how you're using the ball. So, what speed are you throwing it? How far are you throwing it? Ball wangers are not a good idea. I don't think they're ever a good idea, even for fit, healthy dogs. Personally, I know that some vets think they're fine, but I don't personally think that they're a healthy idea. But yeah, so just looking at, depending on the capability of your dog, kind of slowing down the speed that you're throwing the ball and kind of breaking it up. So instead of ball, 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 you do maybe a couple of ball throws and then you go and do something else like sniff, or you walk on a little bit to another part of the park. So you're breaking it up. How do you know whether it's too much? It is really difficult in the early stages of the disease because you're probably not going to see that stiffness the next day or the day after or the day after. But if your dog is exhausted, panting, kind of unable to snap out of the activity, has been doing the activity to the point where its heart rate is high, its rest rate is high, that is probably too much. Even if your dog is perfectly fit and healthy, it is probably too much. Apart from anything else, as a neuroscientist, I think then you're running into the danger that the ball fetching becomes addictive rather than fun.
Yeah, I agree to that. And I think you said something to me the other day, because Luna wasn't really allowed balls when she was a youngster because I was so concerned about her being so compulsive, being a collie. And she's now quite addicted because of lockdown. People have been throwing sticks and stones and stuff out on walks. I can snap her out of it. So when she's looking for someone to do something, I can go, Luna, come over here. And she's like, oh, okay. Yeah, all right. I'll come over. And that to me is, I'm hanging on the edge. I'm on the edge of this becoming an addiction, but I can get her out of it. The other things to think about with the ball, don't put it in long grass. Ask your dog to wait.
Yeah.
Ask your dog to go and get it.
And hide it.
Hide it. Let's get rid of this throwing thing. Let's think about this ball being this amazing gift that they love playing with, but let's try and remove the impacts away from it.
Yeah, exactly. I threw the ball twice for Zebedee, my puppy, and he brought it straight back, and I thought, you're never having another ball thrown to you. You're so obviously going to get addicted really quickly.
Yeah.
So Mario asks, what should I do if my dog has overdone it? So if she can tell that, all right, too much yesterday, what should she do after that?
Yeah, depends how bad, really. So another way to talk about having overdone it, you've got what's called breakthrough pain. So you've got now a higher pain state and your dog's stiff, less willing to move, less willing to interact because they're uncomfortable. And if that's significant, then it might be that you have to top up with a pain relief or a different pain relief, what we call an adjunct. So you could certainly think there if you're at that end of the scale. If it's only mild, then obviously rethink the activity. Make sure you don't do it again. Try and modify your routines and your behaviors. But rest up for a few days. Take it easy. Have distractions. So licky mats, snuffle mats. Keep them moving, but in a low impact way. You might think about using some heat sacks if you've got areas that they seem quite uncomfortable, maybe their back, their neck, their shoulders. You can use just some nice gentle heat sacks. You can do some massage, but give them a break and then slowly build them up again. But be honest with yourself. If your dog is really, really stiff and is obviously uncomfortable, check in with your vet. And you can always say to your vet, my dog's got a long-term chronic pain condition. I know I'm going to have these periods where we've accidentally overdone it, or something's happened and we've got a breakthrough. What can I have in my toolbox at home to help me through these situations?
Yeah, and then it's a good idea to keep a diary for that, because it's really helpful if you can then look back over time and see how many times you had to use the breakthrough analgesia, or whether your other interventions were just as effective.
All right, we're going to go two more questions. The first one is another Great Dane one, and then we have one about supplements coming up.
I love all these Great Danes.
From Pandora, you mentioned torsion and hard braking. Should I be worried when my Danes get the zoomies around the yard together on somewhat slick AstroTurf? This is a daily episode.
Yes, Pandora, you should. There's nothing more to say.
No, it's really sad, isn't it? Because I can remember when I started becoming more and more aware of how our dogs can damage themselves in our environments. There are places that we choose to live. AstroTurf isn't a normal substance. Lino, laminate flooring, tiles, doesn't provide good traction. So we end up sounding like we're the police. We're like, no, don't do it. But unfortunately, no one can predict when that fall, when that twist, when that high speed turn, when that tumble is going to be a bad one. So I would look at trying to reduce it. You will always regret it.
The other one I had this morning that had my heart in my mouth was I'd taken up the rugs to put them in the washing machine. And I know, right? Zebedee decided to do zoomies whilst he was weeing with excitement, and he created one of those slip and slides in the kitchen, but he did it in like 2 seconds. I don't know how that happened. So I went from having a perfectly normal house and a dog that wasn't injured. I mean, he didn't look injured afterwards, but I'm pretty sure he will have done himself some damage. He was like spinning around on the floor with his legs in every direction, all over a pile of wee.
Don't tell me this.
I know, right? I definitely thought of you as soon as it happened.
All right, so we'll wrap up with a supplement question. I'm gonna combine two in one here. So Brittany asks, what supplements do you suggest? And then I have a more specific follow-up from Sabrina, who has a friend who has a Great Dane with hip dysplasia. In their country, they give extra calcium and injections to strengthen nerves. Would the extra calcium be advisable?
No.
So general supplements, and then also specific to calcium injections.
No, they do not give calcium. That's a really dangerous game to play. So I would definitely steer clear of that. And I don't know what they're talking about strengthening the nerves. So that's an area I'd need a bit more detail. So I would stay away from any kind of supplementation. I would stick to a balanced, recognized, Pet Food Manufacturing Association supported diet. They are going to be balanced. They're going to have the right amount of all your minerals and vitamins in them. You should not need to supplement. With regards to supplements that are good for arthritis, the jury is 100% out on omega-3 fatty acids. So if you're going to invest your money somewhere, marine-based omega-3 fatty acids have got our seal of approval. They're not going to work quickly, guys. You're probably looking anywhere up to 12 weeks before you're going to see any benefit. They're a supplement. They supplement anything that we do. If they were the be-all and end-all, they'd be called the Grail. They're not. They are a supplement. So they're going to take a while to work. You're looking at marine-based freshwater supplements. Don't go for plant-based omega-3s, because the dog's body cannot convert it into the active forms that we need. So don't go plant-based, go marine-based. There is so many others. It is the absolute burden of my life is the world of supplements, because it's not just about the supplement, does it work? There is so little regulation in that industry. You might have a product that says supplements that you think, oh, that's a good one, that's a good one, that's a good one. But has that product manufacturer produced a good product? Is what they say in the packet, is it a good quality version of that supplement? There is no regulation on that. So it's very, very hard to guide people.
Great. All right, Dr. Murphy, Dr. Capon, thank you very much for being with us today. And Hannah, why don't you tell us what's coming up tomorrow?
Wow, tomorrow I've got another lovely friend coming to visit. So Dr. Amber Batson is going to be coming and talking to us about sleep and the importance in managing pain, making sure that they have good sleep. And we're going to go right into the science about it. So it's not just airy-fairy, we're going to really look at the detail.
Great. Well, thanks everybody for being with us today. In the comments, go check out the link to CAM, check out the link to Barking Brains, and then go to the link to sign up for the rest of Arthritis Awareness Week. Get in on one of those $400 daily giveaways, and we will see everybody tomorrow. Thanks, everyone.
Bye.
Bye.